Welcome to the first week of Module 3 of our course, Respiratory System Mechanics. On this module, we'll learn how to assess patients' respiratory system mechanics at progressively more complex levels. The concepts we discuss here will be fundamental to highly practical discussions in the following module, where we'll discuss how to manage the ventilated ARDS and asthma and COPD patients. When we're evaluating respiratory system mechanics, we're referring to the assessment of resistance of the airways as well as the compliance of the lungs and chest wall. We'll start with a global assessment, thinking about whether the tidal volumes we're getting are appropriate given the pressures we're generating. If my patient is in a flow-limited mode, namely volume control, since the ventilator will apply whatever pressure it needs to generate the set flows, if we have an elevation in area resistance or decrease in lung chest wall compliance, what will happen with the pressures that the vent generates? They will go up, just like we discussed in Module 1. Likewise, if you're in a mode with an adaptive targeting scheme where the vent will adjust the amount of pressure it gives to achieve a desired tidal volume, what would you then expect to see with your peak pressure in patients with poor respiratory system mechanics? Well, peak pressures will also go up because the ventilator needs to use higher pressures to overcome that increased resistance or decreased compliance to deliver the target tidal volume within the set I time. What if I'm on a pressure-limited mode where we set the pressure above PEEP to be delivered? Would you expect to see an increase in peak pressures in a patient ventilated in pressure control, say if they develop a tension pneumothorax, a condition that will decrease their compliance? No, right? What would you expect to see instead? Well, you would expect to see a drop in tidal volumes, as the set pressure will deliver lower volumes to a lower compliance system. Looking at a few examples of passive patients, you can see that this patient probably has normal respiratory system mechanics, since the ventilator only has to generate low levels of pressure over PEEP, roughly 12 centimeters of water, to deliver a tidal volume of close to 500 mL. It's pretty good. In this other case, though, mechanics are clearly abnormal, since we're needing roughly 35 centimeters of water above PEEP to get to pretty small tidal volumes of only 210 mL. Lastly, we see this patient in pressure control, in which 8 centimeters of water above PEEP only gets 110 mL of tidal volume, indicating very poor mechanics. Note that peak pressures are low because they're simply a result of the settings we choose. In pressure-limited modes, they will always be roughly your PEEP plus the pressure set above PEEP when we're the ones setting that pressure. Although very helpful, this global basic assessment is far from being perfect. There are several factors other than area resistance and lung chest wall compliance that affect the relationship between the pressures we generate and the tidal volumes we get. On the next lecture, we'll go over some of these factors as well as lay the foundations for subdividing our assessment of the respiratory system into each of its components: the airways, the lungs, and the frequently forgotten but very important chest wall. I'll see you then.